We've all been there. You wake up a little stuffy or sneezy and you begin furiously Googling your symptoms. But with the recent drop in temperatures, how do you know if it's a cold, flu, allergies, or COVID? According to internist and intensivist at Belize Healthcare Partners, Dr. Jorge Hidalgo, it can be hard to tell, as they all have similar symptoms. He breaks down some of the critical differences.
Influenza season is right now, no? And of course, there are many symptoms that basically the COVID-19 and influenza share, but also there are some differences that we need to take into consideration. No? I mean that we can say that essentially like coughing, fever, and general malaise are symptoms that both conditions share. Now, also in terms of symptoms that can differentiate one of the other is that the COVID-19, most of the time, the symptoms can express that they are lost the sense of smell, the sense of taste, and this is some symptoms that basically are part of COVID-19. We don't see those in influenza. No? 80% patients with COVID-19, they probably be completely asymptomatic or develop just mild symptoms, like they probably just have a loss of smell and taste, versus that influenza, it can be more sudden. You can have a fever, you can have a lot of runny nose. You also can have those in COVID, but it's not very common. And general malaise, body ache, fever, and that's most of the time that we see in influenza. And in case when we see those patients with COVID with this the type of symptoms, most of the time, one of the most important conditions to differentiate that it's COVID usually tend to present with shortness of breath. We need to mention an additional condition that is important, and is seasonal allergies. You know? And most of the patients that suffer from chronic allergies, they more or less tend to recognize their symptoms. Unless something different, then they seek or they know that they need to come to the doctor.
But as the daily COVID case counts and deaths keep rising in Belize, he recommends getting tested to be sure.
So what you're saying Doc, is that basically don't take any chances if you have these symptoms.
At this stage, one of the most important messages is please don't take any chances, because in terms of the aggression of the virus and how sick you can be, of course, if you get COVID-19 and in a severe form, you know that you will end it in the hospital, and also eventually you will end it in the ICU, and we don't want that. I mean that simple things to trying to recognize early and seek for medical attention early. There are many patients that right now they are trying to treat themselves at home based on Dr. Google, but of course that is not a good advice. No, it's best if you are guided by your family physician and helping you going through if either it's just an influenza or also if it's a COVID-19 in a mild to moderate cases.
How quickly can it go from bad to requiring intensive care treatment?
I mean, at the moment you start with shortness of breath, this is an indication that you need to come to the hospital. Also, you can do a simple trial at home, trying to go to your room, walk into the bathroom, and if that tires you and that make you feel gasping, or you feel that you need air, then this is an indication that you need to come to the hospital immediately, because things are not going right.
Hidalgo is currently the head of the COVID-19 unit at Belize Healthcare Partners. The unit can treat 6 patients at a time. He says it has been functioning at capacity for weeks. He urges all Belizeans to do all they can to stop the spread of the virus.
We definitely feel a lot of frustration when, despite of everything, despite of you guys as a media are promoting, and in a different ways, if you go to the internet, or you just walk outside and you see all the signs advising that you must adhere to social distancing, and you see people reluctant or laughing or joking about it, is very frustrating for us as a medical in the medical field, no? Especially when we see patients in COVID-19 units in ICU, they're struggling, connected to a mechanical ventilation for 3 to 4 weeks. Then we don't want people to end in an ICU. We have the COVID units and it's available, but we, of course, we don't want for you guys to end in those units struggling and suffocating for air.
Once again, remember to wear your mask, wash your hands, and watch your distance. If you are experiencing symptoms of COVID-19, call the Ministry of Health's hotline at 0800 MOH Care or 0800 664